Was it worth it? So, the question I'm going to talk about today is the impact of the coronavirus guidelines on education, more specifically on students. So, let's begin with stating the obvious. COVID was hard. Whether it turns out that, you just had a hard time during it, maybe socially, physically, maybe you got sick, maybe someone you loved got sick and passed on. All in all, 2020 and specifically the COVID time was a hard time for all of us. And it can be pretty clearly stated that the guidelines affected students both, all in all, in areas of mental health, physical health, and academic achievement. So the argument that I would like to make is that the COVID guidelines wreaked such havoc and did such damage on students' psychological and academic well-being that they were not worth the physical safety they provided. And a lot of people who would rail against the COVID guidelines because of the psychological and academic effects tend to not agree with me. And this is my concession here, is that data shows the guidelines did secure physical health for high school and college age students. Masks, quarantines, and some of these other guidelines proved remarkably effective in terms of preventing transmission and death amongst student populations. And here is data supporting this from the New York Times, from the Atlantic, from the Kaiser Family Foundation, the Census Bureau, just from all these different sources. You notice that in the middle chart there, it talks about totals. That little orange slice is the total amount of college students as a percentage of the U.S. population. I'm mainly focused on the U.S. To your left is cases. Same thing. It's a much smaller sliver than what you can see, when you look proportionally. And then deaths, you can't even see the sliver of college students who passed on. Now, I'm not going to minimize the deaths of those who died of COVID who were college age because it was tragic. However, when you take a look at this, college students tended to get sick less, as well as COVID proved fatal less often than it did to the general population. So a lot of people would ask, college students have a strong immune system, right? And in fact, they would be incorrect. When it comes to, sorry, definitely messed up there, but college students do actually, in fact, have a stronger immune system. They are correct. I'm incorrect there. But the younger you are, the stronger your immune system tends to be. And researchers at Penn State actually determined that college students got sick more often because they, were more socially active. They lived closer together. They suffered from more stressors and therefore were more susceptible to illnesses. So a flu or a cold or even COVID, you would think would spread faster in a college environment. However, we can point to the guidelines as the reason why the data doesn't in fact demonstrate that. In fact, it shows that college students tended to be more safe. Now, with that in mind, yes, they protected physical health. However, they absolutely derailed psychological health and well-being, whether that's in a mental sense or in an emotional sense. So, one of the big things that, policymakers and administrators around the world are trying to solve is the world mental health crisis. There's been higher instances in general of anxiety, depression, all these other negative, how to say it best, just negative disorders. But it's interesting. So researchers for the Pakistan Journal of Medical Science determined that there was a higher psychological burden on students, both whether adolescent or child, who were in quarantine or in some of these COVID protocols. And so they created this absolutely crystal clear connection between these guidelines and higher instances of negative mental and emotional health. So another thing that would connect with that, this is what I would call a tale of two districts. I used to live in Virginia in Fairfax County. We moved out before COVID, but I still had a lot of friends who lived out there. So a lot of this comes from their firsthand experience. I moved to Alpine School District, where the difference is that Fairfax County completely required masks until early 2022, whereas Alpine required it for the 2020 to 21 school year, but not this past school year, which has gone from 2021 to 2022. Fairfax County was online until the beginning of this past school year, when Alpine School District was not requiring masks and went normal in early 2022. However, Alpine School District went to a mostly normal schedule. We have shortened Wednesdays But other than that, completely normal schedule this past year. And even last year, we were in person as much as could be done. Now, another issue here is disproportionate effects from these guidelines. This one's near and dear to my heart. I'm hearing disabled. I cannot hear out of my left ear. And I never realized how much I read lips until masks took away that option. And therefore, although I felt that I was able to learn things well, I also had to work a lot harder than my peers, perhaps, to be able to keep up in class. And this has also been the case when I've talked to parents of hearing disabled students who are younger. Just across the board, COVID affects them at a much differently and perhaps much harsher than other students. And this could also be true for a student who's asthmatic, who can't breathe well with a mask, yet has to wear one to protect others, and therefore is not comfortable in a school environment. It disproportionately affects certain populations, which is, of course, a negative effect. Now, another major problem for UVU is that scientists for Frontiers in Public Health discovered that international students have even higher rates of some of these psychological issues when in COVID protocol. And UVU has, according to the UVU website, 550 plus international students who bring a unique perspective to our campus. However, we can't tap into that, but more, it's harder to do so when they're suffering from these psychological issues, especially so far away from home and the support systems that they know. So now the other major factor that the COVID guidelines negatively affected was academic success. This chart demonstrates the drop in AP tests. 2020, I did not include because it was an open note, open book testing time. But you see from 2018 to 2019, scores were on the rise by maybe 1 to 3 percentage points. But then between 2019 to 2021, when these tests were administered in a normal fashion, we noticed a major drop, about 6.8% in calculus, 2% in computer science, and about a percentage in government and politics. And although these may not seem like large numbers, on their face, 1% isn't that much. That's still 40,000 plus students. And this is a number coming from this website, Total Registration, where they track all of the scores and the distributions of them. And so 40,000 future business leaders, potentially, and perhaps political leaders. That's why I chose the test to look at that I did, that some of these future business leaders, future political leaders will have major gaps in a foundation that could be useful to the future economy. And that economy will grow in sectors such as engineering, which requires calculus, or computer research and development, which computer science would help grow. And again, going back to politics, government and politics, they could potentially be missing a foundation, which is something that could negatively impact the future economy. So just to wrap it up, again, like I began at the beginning, the COVID guidelines did protect the physical health of students. You can't argue with that. When you look at students do, in fact, tend to get sick more often. However, in terms of COVID, the stronger immune system, I feel, is canceled out by the tendency to get sick more often. But students didn't get sick more often, which is thanks to the guidelines. But the negative impacts outweigh the positives because academic success was lowered, psychological well-being was lowered. And this is, in a sense, looking at the short term. In the short term, the guidelines worked, but in the long term, they could wreak unknown havoc on the future economy and student populations. Here are my sources. And lastly, here are my discussion questions. So do you agree with my conclusion? Why or why not? And would you say that it is fair to say that multiple negatives outweigh a positive? And the other question would be, what aspect of safety would you personally consider to trump the others? Some might say that without physical health, the other forms of health are irrelevant. Yet others might argue that mental or academic health are far more crucial.